Hello everyone. I'm Rundy Murphy, epidemiologist and Director of Disease Surveillance at the Mobile County Health Department, here to give you our daily update on the impact of the COVID-19 pandemic on Mobile County residents. Around the world, we're seeing almost $9.3 million cases of COVID-19 disease, with nearly $480,000 death. I'm stuck on dollars today. 480,000 deaths. In the U.S., almost 2.4 million cases with over 121,000 deaths. In Alabama, nearly 32,000 cases and nearly 900 deaths. In Mobile County this morning, we saw the largest number of COVID-19 cases added in a 24-hour period since we first began counting COVID cases back in March. So yesterday alone, 103 COVID-19 cases were reported among Mobile County residents. And again, that's about 35 more than our second highest single day report since March 19th, when our first case was announced. So far, we had been seeing, up until yesterday, had been seeing what we thought was just a slow, gradual increase in the number of cases added, and we're quite shocked to wake up this morning to see that over 100 cases were added in one day. When I tried to look a little bit more closely at these reported yesterday to see if I could figure out what was driving that large increase, you can see that there was a nearly 450% increase in the number of cases added in one day in people aged 18 to 29. So again, this fluctuates day to day, so we can't really sort of hang our hat on one number. But yesterday, 35 cases were added among people aged 18 to 29 compared to just 6 the day before. So again, it adds some strength to this pattern that we're seeing, that most of our cases reported over the last few weeks are being driven by the younger age categories, people who are younger, who are healthier, who will not suffer severe complications, but will have rather a mild illness or perhaps even asymptomatic infection. And we believe that that is what is driving community transmission around Mobile. We still have seen a low number of new hospitalizations and a low number of new deaths, though it's important to remember that these measures lag behind the case count, because when someone first gets sick or is first diagnosed with COVID-19, they generally are not sick enough to be hospitalized right away, and it takes some time through the natural course of illness for someone to become sick enough to be hospitalized, and then sometime after hospitalization before they may eventually die with COVID disease. So again, we're going to continue to be taking an incredibly close look at the number of cases that are reported daily, and also trying to understand what those patterns mean to our community. So I have quite a few questions here. This large increase prompted some interest from the media today. Several people asking if we could confirm that the 103 added yesterday is correct, and yes, it is. And that is by far the largest number of cases added in any single day since we began keeping track of the number of COVID-19 reported. So again, we'll continue to keep an eye on that. Someone asking about masks and why wearing a face covering is important. And again, a cloth face covering is so that I can protect other people in the community from germs that I may be carrying, right? It keeps the respiratory droplets that are expelled when I talk or cough or sneeze or sing or laugh. It keeps them, closer to me and not 6 feet headed out to where you might pick them up. So again, that's the reason for wearing the mask. There are people out there who don't believe that masks can provide any protection. I will admit that there's not a lot of strong science on the wearing of a cloth face covering because there are so many different versions of a face covering. If I make it with cotton, that's different than if I make it with linen. If I have 2 layers of fabric, then it will be a different level of protection than if it's a single layer of fabric. So there's no sort of standard making of a face covering, which makes it incredibly difficult to conduct any scientific studies to say that wearing the covering, reduces your risk of transmission by X%. So I get a lot of questions about that, and it's just nearly impossible to quantitate the benefit of wearing a cloth face covering in slowing or reducing the spread of COVID-19 transmission. But one thing I know for sure is it is an added benefit, and it certainly can't hurt. So again, this is just one thing in our arsenal. We're still using, cough etiquette, staying at home when you're sick, washing your hands thoroughly, disinfecting surfaces, keeping a 6-foot physical distance, and wear a cloth face covering. These things in combination will contribute to slowing the spread of transmission in our community and protecting those around you from getting any germs that you might have and you from picking up their germs. So there's a question about several restaurants around Mobile closing temporarily because of COVID-19 and their employees. The question is, how long should a restaurant remain closed? And the answer to that is complex. If they have been implementing the safer at home recommendations, they may only need to close and disinfect one part of their facility or one part of the restaurant. But if the restaurant, or this goes for any business, I don't want to pick on restaurants, but if businesses are following the advice of the safer at home order and maintaining, 6-foot physical distance, people who interact, wearing masks on employees who interact with the public, trying to restrict staff movement among a facility. If you have a big box store, maybe just have employees working in one department and not working all over the store, so that if one becomes sick or is diagnosed with COVID, you can isolate the area that you need to disinfect and maybe just close down that area and disinfect it and then open it up the next day. But what we're hearing is that some of the facilities, the businesses that decide to close, are doing so because they had not fully implemented the safer at home orders. They were not following the guidelines put forth through the state health order that lasts through July 3rd. And because they cannot identify where there may have been transmission or exposure or close contact within 6 feet for 15 minutes or more, they have no choice but to close their entire facility, thoroughly disinfect and sterilize, and then open a day or more after that. There's an add-on question from this media source saying, are there requirements for restaurant employees to wear face masks? And yes, there are. I continue to get questions from businesses who very clearly have not read the governor's order, because it clearly states that anyone who from a restaurant who interacts with the public shall wear a face covering. It's not a suggestion, it's an order. So go in here and read it if you're a business owner or a manager and you have not already done so. I also want to point out another sort of type of business that seems to not be heeding the advice or the order of how they're supposed to safely reopen. And let me see if I can find that quickly. And this is close contact service providers. So effective May 11 and going through July 3rd, close contact providers such as barbershops, hair salons, waxing salons, threading salons, nail salons, spas, body art, tattoo, massage therapy shall comply with the following rules. This is a rule, not a suggestion. Employees shall not knowingly allow clients or persons to accompany a client to congregate within 6 feet. Employees shall wear a mask or other facial covering that covers his or her nostrils and mouth. Employees shall wash their hands thoroughly with soap and water immediately before providing services within 6 feet of a client. A close contact service provider shall take reasonable steps to regularly disinfect frequently used items and surfaces. So I have heard from many people that are going back out to get haircuts that if people washing their hair are not wearing face coverings. That's a violation of the state health order. All right, so let's see, a couple more things. Someone else had a question about, the fact that some businesses have closed. Is that a sign that we reopened too soon? It's not necessarily a sign that we opened too soon. It's absolutely a sign that these businesses are not following the order and they're not following the guidance that accompanies that order. If they were, then they would not have to close down their entire facility and instead would be able to isolate a location that may have had a COVID positive employee or a resident and be able to disinfect just that area. Let's see, here's someone asking that some Baldwin County, everyone looks at the map and sees that there are so many fewer cases in Baldwin County, and here is a hypothesis that Baldwin County has lower test capability, that it's not as easy to get tested there, and that they're being told to come to Mobile to get tested. And so since we have in Mobile a lot of unknown zip code, is it possible that some of the cases we report are from Baldwin? There may be a few, but it's unlikely that there are many, because again, when we interview that patient and we confirm where they live, if that patient resides in Baldwin County, we transfer the investigation to investigators in Baldwin so that that person can be counted as a Baldwin County resident. So we have a lot of Mississippi residents that get tested in Mobile. They are not included in our numbers from other counties, surrounding counties in Alabama. And again, as soon as we recognize that they are not residents of Mobile County, then we transfer them out to the appropriate jurisdiction. Okay, yes. Confirmation that yesterday's 103 COVID-19 added is the largest single day increase in the number of cases since we began recording cases on March 19th. All right. Here's someone asking, in the context of the public's right to know and right to stay healthy, if a waitress at a restaurant tests positive, what are my rights to know if she waited on me that she was positive? And we've talked a lot about the HIPAA privacy rule and how that protects our our ability to share protected health information with anyone other than the patient or their provider. There are some relaxation of the HIPAA privacy rule during federally declared disasters. We are using those relaxations to do things like, sharing information with first responders, or, to the extent possible, using other entities as an extension of our public health arm to help us with data and that sort of thing. But the only thing that's protecting you from that waitress is your social distancing and a mask when you're not eating. So if you have been named as a close contact, then we will call you and let you know. We won't tell you who you've been close to or who might have exposed you, but we will let you know. But as you can imagine, in a restaurant where the service providers are not wearing a mask as required by the emergency rule, if they are waiting on you, then you are putting yourself vulnerable to being within someone who may be spreading COVID within 6 feet for greater than 15 minutes cumulatively. It's not a single episode, it's 15 minutes cumulatively. So by all means, if you're in a restaurant and your server is not wearing a mask, please ask them to stand 6 feet away when they take your order to protect yourself. Or better yet, pick up curbside and take it home. Let's see, here's someone asking if we have any numbers on positive test results from local colleges and universities and high school athletes who may have returned to summer workout schedules. And no, I'm not aware of any cases of COVID-19 linked to those. But again, remember, as I mentioned earlier, that the age group with the largest rate of increase of positive cases is 18 to 29 age group. Let's see. Here's someone asking about the single day spike. Is there still capacity at the hospitals? Yes, there is. We're still seeing between around 55 on average patients hospitalized on any given day with COVID 19. We still have capability or capacity with ICU beds and plenty of ventilator capacity. So that is really good news. And then, kind of a no-brainer question, is the health department alarmed about the trends going back in the wrong direction? And yes, we have been concerned, keeping a watchful eye, continuing to remind people that we're not out of the woods and that we need to continue physical distancing, stay at home if you're sick, cover your cough, wash your hands, wear a face covering when you're out. And here are some things from Facebook. Which app is for our state? So the Alabama Department of Public Health I has entered into an agreement with Sarah Alert to assist us with contact tracing. So Google Sarah Alert, SARA, contact tracing, and you can see what's out there publicly on that app. It's a question about have treatment intervention improved outcomes. So we think so. There have been two promising treatments that we know about. One is treatment with plasma from patients, from previously positive COVID patients, that this is a clinical trial going on. And we have heard that there are promising outcomes there. And then the drug remdesivir had promised such promising outcomes for people who are hospitalized and in the ICU that the Department of Health and Human Service began just pushing it to states, just giving it away so that hospitals could start providing it to their most ill patients. And we believe that remdesivir being used in the state has helped. So that is really good information. Let's see, here's a question about the fact that a lot of 4th of July activities are being promoted and the governor's safer at home order ends on July 3rd. What do I think will happen? I think we'll have to wait and see. But with this incredible rise in the number of cases in Alabama, I doubt that she will lift that order. So we'll have to wait and see what the governor and health officer decide to do. So let's see. Here's a question about how does social distancing, wearing a mask, washing your hands, how does that slow the spread of the illness by isolating the person who might be infectious or may be exposed? So we ask people who are symptomatic to stay at home so that they're not spreading germs knowingly. We know when they have symptoms that they are infectious, that they can transmit their disease to other people. So we ask them to stay at home for many days after they're already ill. And then for people who are known exposed, we ask them to stay at home so that they don't unknowingly spread germs during asymptomatic infection or during pre-symptomatic infection. So we know now, we didn't know this 2 months ago, but we know that you can be infected and spreading the virus but have no symptoms. And so if you are known to have been exposed, we ask you to stay at home so that you don't unknowingly transmit the infection around the county. Let's see. Here's a good question. This is a new one. In regard to contact tracing, someone asked, are phones always identified as Mobile County Health Department or Board of Health in the caller ID? And the answer is not always. If you get a call from one of our desk phones or one of our landlines, in one of our physical locations, it likely will show up as Board of Health. But many of our case investigators are teleworking at home using their Mobile County Health Department cell phones, and those likely will not show up as the health department on caller ID. But remember, the person calling you will already know your name, your date of birth, the date you got tested, where you got tested, what your test result is. This is not the kind of information that scammers will have. So please be very careful and make sure that you protect yourself from any scammers out there trying to collect protected health information from you by giving you a call claiming to be the health department. And then I think this last question is someone wanting to know if people who have the capability of teleworking or working from home, should they continue to do so? Absolutely. You are safer at home. So if you can work from home and your business or your supervisor or owner permits that teleworking, then please continue working from home because you are safer there. And I don't know how long that's going to be true, but probably for a very long time, months, probably, possibly even years. So I think, I've said before that we sort of need to settle in to accepting a new way of doing business, a new way of worshiping, a new way of interacting socially with our friends and family members, and it will help us survive this very tragic pandemic that we're experiencing right now. So before I go, I just want to send a shout out to Virginia Gordon, who did a very nice Wellness Wednesday part today, talking again about the civil unrest and how to sort of manage stress and distress associated with things that we see in our community. So you can catch a recording of that on our Facebook page or on YouTube. So thanks again for your attention today. Please continue to social distance and wear your mask and wash your hands. I really hope not to see another day of record COVID-19. Thanks.